Welcome, Greek U Nation, to episode number 556 of the Fraternity Foodie Podcast. I'm your host, Dr. Mike Einlon, CEO of Greek University. I'm a speaker and an author. Our sixth book just came out. It's called I'm So Beautiful, It's Ridiculous: Unleashing and Promoting Strength, Self-Worth, and Real Sisterhood. So go and pick up that book on Amazon or Barnes & Noble today. We call these episodes the Fraternity Foodie Podcast because there is nothing like great food to bring college students together. Fun fact, over the last year, I really got into cooking meals at home with fresh ingredients instead of relying on eating out all the time. And I have to tell you, it's been really fun learning how to cook these incredible meals. And I got to tell you, my blood pressure went down, my weight has come down as a result. And I know it's super tempting for us all to go out and get fast food, especially as a college student. But I really, really wish that I would have cooked more at home as a college student. What a great skill to have. Let's talk a little bit more about it on our show today. Dr. Jerome Puryear has over 30 years of healthcare experience with over 25 state medical licenses. He is board certified in obesity and medicine and health and wellness coaching. Dr. Puryear helps clients get the health care access they need and deserve through coaching, education, and empowerment. Dr. Puryear has done it. He is an author, a speaker, and he provides critical health and wellness education as well as knowledge to consumers. Dr. Puryear will give your audience real life experiences from the front lines of healthcare on navigating the healthcare system, preventing disease, and avoiding premature death. Welcome to the show, Dr. Puryear.
Thank you. Thank you. I appreciate being here.
Hey, it is an honor to have you on the show. Thank you so much for sharing all of your great information with our college student listeners today. You know, I always like to talk about college because I think it's such a formative part of our life. And you decided on Purdue University for your undergraduate experience. That is a phenomenal institution. Nobody's going to deny that. Why did you decide that Purdue was the best choice for you?
Yeah, it was a difficult decision, I think. I think when you're in high school, you don't really know where you want to go to school. And so actually I chose IU Bloomington to go to school first.
Uh-huh.
So I was in the IU Marching 100 and after the first year, I realized that, that really wasn't the best fit for me. I don't think I was supported, as well as I could have been. And so I, did a round of interviewing with some other institutions, and Purdue was one of them. And it didn't take me long to realize that they had caring faculty. It was just the place for me. I mean, I liked the majors that they had. I thought that I could major in something and get a job after that. And so and it wasn't a choice that I regretted at all. I
Yeah.
really enjoyed the time there. It was just a good fit. Even today, I still remember my professors, particularly the ones in organic chemistry and the ones in physics. I mean, they were just gurus in their own field. And I still remember the lessons that they taught, in the subject matter and in outside of that as well. So I don't regret that choice, and I think it's a good place to go to school.
It's a great place to go to school. I can't say enough good things about Purdue, and the professors that are there and the students that go there are just brilliant. I mean, they are really, really bright. So I think some good things are happening there at Purdue, and I'm happy that it all worked out. I'm happy that you found your place to shine because I think that there's a place like that for everybody, and you found it. So good on you. I think that's just awesome. And in 2002, you completed your residency in diagnostic radiology at the University of Alabama at Birmingham. Then you served two consecutive fellowships in interventional radiology and neuroradiology at Jackson Memorial Hospital. And then finally, after all of this, then you decide you're going to cap off your studies. You're going to complete the Duke Health and Wellness Coaching Program in 2023. So you've obviously, I mean, it doesn't take, a brain surgeon to figure this out. You have a passion for helping patients to transform their lives and maximize their health and wellness. I need to know, where did all of this come from?
I know it's a lot.
It's a lot.
Kind of a unicorn in that respect, in that regard. I think a lot of it came from just my upbringing. My mom was a surgical nurse, and she had a passion for her job, and I think I took that in as I was growing up. And I just think that was invaluable to me. My dad was an educator, and so he enjoyed his work as well. And I think the combination of the two really played an important role in determining what it is that I wanted to do. They didn't guide me into medicine at all. They, kind of let me decide what I wanted to do. And I knew early on, I would say fifth or sixth grade, that, there was something that I wanted to do that was special. And I think, fast forward a little bit, I think, having 20, 30 years in medicine, knowing how the medical system works, or doesn't work for certain populations of people, I think that really solidified to me that people really are not aware of their health, and they're not aware of how to get help in this system. And I think that, being on the inside, because radiology is you don't really see us a whole lot unless you come to the hospital, is a profession where you get to see a lot of what happens in the hospital, and you get to identify with a lot of the patients that we see, and they don't get the care that they deserve in some cases. And I think that was something that propelled me to go on to get board certified in obesity and medicine, and then get board certified in health and wellness coaching from Duke. I just, you kind of realize that, 80% of chronic diseases are preventable. 80% are preventable. We're talking about diabetes, stroke, heart attack, all preventable by what? Lifestyle changes, whether it's not smoking or, not drinking significant amount of alcohol, so, we determine how we want to age. We don't realize that, but we determine how we want to age. And if we don't think about it, it will happen naturally and probably not the way you want it to happen. So it's very important for people to be knowledgeable about their own health. And so, it's one of the things that people don't think about their health until it goes bad.
Hmm.
You know what I mean? You don't really think about, your health until you don't have it anymore.
Right.
And then when you don't have it anymore, it's a little bit too late to start thinking about it, So, part of my goal and my passion is to get people to think about it earlier on in their life so they can have the quality of care that they really want.
Yeah, prevention is key. You're absolutely right. I mean, you could have all the money in the world, but if you don't have health, there is nothing you can do about that. There's absolutely nothing you can do. And I love that you took that love for medicine from your mom. My mom was an ER nurse for 40 years, and she still tells me that she knows more than some of those MDs that she was working with. But it's all good. It's all good. She's something else. She definitely knows how to navigate a hospital. I will tell you that. There's no question. If you are, in trouble and you're in the emergency room, you want my mom next to you because she will navigate that thing like you have never seen. I've seen her bring the president of the hospital down to the ER to demand the care that is expected. I mean, she is just a force. So it's been
Um,
fun watching her.
I mean,
Um,
sometimes you have to do that. I mean, sometimes,
yeah.
because of the way that the system is structured, there are
Mhm.
not enough nurses. They're covering a lot of different patients. You're the patient. Many times patients come in and they don't have an advocate for them. And so
Correct.
they have to advocate for themselves, as, and they're the ones that's sick. And so it's a little bit challenging to do a lot of that and to get the care that you need and that you deserve. And so sometimes you have to demand it, and sometimes you have to go up the chain to
Right.
kind of get the care that you need.
That's
So I understand
100%
that.
right. They don't have advocates. That's the big problem. And they don't know how to navigate all that unless you're working for the hospital. If you work for the hospital, you know how to navigate that thing. But if you're an amateur and you don't have an advocate,
Right.
boy, oh boy, that can be a really troublesome place. So, the college students that are listening right now, I'm going to tell you about them. They are completely stressed out. They're stressed out about their large school workload. They're stressed out about the rising cost of higher education. I don't even have to tell you about that. It could be they don't can't afford the food at the grocery store. The prices are insane, and the high interest rates right now in terms of even just buying a home. So there's a lot of stress on this generation. Do you have any stress management tips for them?
Well, I think let me back up a little bit. Stress is a normal process. It is a normal process, particularly in the acute environment. It's our fight or fight response. It's you're either going to confront the threat or you're going to escape it. And that's what the flight or flight response is. And so under the normal situation, it's normal to have that stress. The problem becomes when that stress lasts for weeks or for months.
Mhm.
That leads into chronic disease. And that's the problem. But the one thing that I like to tell people and that I was always been told is that sometimes we worry about these things, but we worry about things that we can't change. You
Mhm.
know, there's a serenity prayer. God, grant me this serenity to accept the things that I cannot change, courage to change the things that I can, and the wisdom to know the difference. The wisdom to know the difference. And
Mhm.
so sometimes we worry about things that we can never change, bringing upon stress upon ourselves that's unnecessary because there's nothing you're going to be able to do about it to change it.
Mhm.
But for those things that you can do something about it, you know, we always recommend lifestyle changes. You know, do you have a normal exercise routine? Are you eating healthy? Are you eating fast foods? Or, you know, if there's no other option, are you choosing the healthy items off of the menu at the fast food restaurant? You know, if you want the burger, do you have to have both pieces of bread or can you just have one piece of bread? Do you have to have all those condiments on there that add additional calories? Or can you do without some of them? And most importantly, the third leg of this is sleep.
Mhm.
Is your sleep restorative? Is it restorative? And do you know how to go about getting the right amount of sleep? And so you have to kind of create your what I would call a sleep sanctuary for yourself to make sure that you get restorative sleep and that you do the right things prior to going to sleep so that you get that. Other things you can always have relaxation techniques. You know, you can have some mindful meditation. You can do yoga. You can do, you know, walking meditations. All those things kind of help. I mean, everybody has their own way of relieving stress. It could be recreational sports or whatever that you do that you like to do. But you need to be mindful about what it is that you like and that relieves you of that stress so that you can do it regularly
Hmm.
and so that you don't
Let's
have.
drill down a little bit more on that. You were talking about exercise, you're talking about walking, etc. What specifically do you recommend for busy college students in terms of exercise? What does that look like?
It really depends on the individual person. I think
Hmm.
everyone would want to go to the gym, you know, 3 or 4 days a week, you know, and use the gym, but sometimes you just don't have that time.
Hmm.
You know, sometimes when you don't have the time, there are always decisions that you can make during the day that can make the difference. Let's say, you know, instead of taking the bus or taking a car, why don't you take a bike or walk to class? Instead of taking the elevator, how about take the stairs instead?
Mm.
It's everybody sits down a lot while they're, you know, studying. How about taking some standing or walking breaks, you know, so that you don't stand and sit for a long period of time. And of course, there's always benefits to getting together, doing recreational sports and that sort of thing. Um, but you know, if you want to go to the gym, I think that's also, you know, advantageous too. You can do HIIT training, you know, short bursts of exercises with, you know, periods of rest. You can do that in your dorm. You know, you can do jumping jacks, squats, push-ups. You can do all that in your dorm. You can do body weight circuit training, you know, squats, lunges, push-ups, all in your dorm. You don't need to go to the gym to do all that. So, you know, don't think that, you know, I don't have the time to do this. These things actually benefit you because it reduces your stress and your anxiety. It improves your overall sleep and it causes you to focus more in what you're doing. So there's a benefit in doing this. It's just not something extra that you're doing. You're doing it as a part of a larger plan so that you perform at a higher level.
Hmm. Well, thank goodness for my big brother in the fraternity. He's the one who really taught me how to work out and how to go to the gym and get the results that I wanted for all the different muscles in the body. And I'm just thankful for that gift because now he gave me something that I can use for the rest of my life, this tool that he was able to teach me. So, I definitely suggest if you are going to go to the gym, find somebody who actually knows what they're doing and can really guide you through that process. And I'm sure the gym has that, but I'm sure there are other students on campus that would love to help you too. So,
Right. I agree.
so there you go. Let's talk a little bit about those healthier habits and drill down a little bit more here in terms of eating right as a college student because they're always on the go. It's always like it used to be in college that we would sit down as brothers and sisters and we would have meals together. And that was like the big thing. But I don't see that anymore. Now it's like I got to get to class, so I'm going to grab this granola bar as I'm running out of the house, and it's like on the go constantly. And then in terms of sleep, I mean, you talked about a sleep sanctuary. I mean, I don't even know how I create a sleep sanctuary. Like, tell me, how do I do all of these things as a college student?
Well, I think it all, again, it gets back to being mindful about what you're doing. If you don't
Mhm.
think about it, then you're not going to execute the plan. You got to have a plan and work your plan. So what's the plan for eating? When are you the type of person that will just go to a refrigerator in the dorm or go to the cafeteria and just get whatever they have? Or
Yeah.
do you have a plan before you go?
Mhm.
Or are you the type of person that if you live in an apartment, are you the type of person that will create your own meal plan and you decide what you want to eat so that it's very controlled as to what you eat and you're not just eating a lot of high carbs
Mhm.
that's going to cause weight gain over a period of time. So there has to be a plan in place. When you go to the dining hall, when you look at the salad bar, get get a salad. Don't get a whole lot of you choose healthy salad dressing, oil and vinegar. Don't choose the fried foods. Choose the grilled foods instead.
Mhm.
Always have water with you. Try to drink 2 to 3 liters of water a day. Choose healthy snacks. That's the key. It's okay to eat snacks, but
Mhm.
you need to choose the healthy ones, so that don't gain a lot of weight, whether it's dried fruits, nuts, rice cakes, those are, relatively low carb.
Mhm.
The other thing is college students, I know that you drink a lot of caffeine, but make sure that if you want to drink caffeine or the power drinks that you drink, the energy drinks, drink them, but try to drink them earlier in the day so they don't interfere with your sleep.
Mhm.
You can drink them, but just not later in the day.
Yeah.
But again, I can't overemphasize having healthy snacks. I can't overemphasize meal prepping if it's possible.
Yeah, I like that plan that you talked about, really kind of identifying over the next week, what am I going to eat, as opposed to just grabbing whatever's in front of you at the moment, right? It
Right.
involves having a plan, meal prepping, like you said, maybe going to the grocery store on the weekends and then getting all the healthy ingredients that you want and then meal prep for the week ahead. That's a plan instead of just arbitrarily just grabbing whatever's in front of you. So I like that idea. I think that that's really, really good. Now, once we get these healthier habits in place, let's say we're starting to meal prep and now we have 7 days worth of meals laid out. What is the key to sustaining that long-term positive change instead of now going back to old habits and going back to fried foods?
Yeah, I think, you know, I've been in this process for a while. I was someone who has done intermittent fasting and the keto
Hmm.
diet and all those things. And the key is really having realistic goals. Your goals have got to match your vision and your values. So it comes back to what is it? What's the reason that you're really doing this? If the reason is that you want to go to the beach on spring break, then, that's very short term. And what happens after spring break?
Hmm.
I mean, so if the reason is something that really means something to you, then I think it's something that can be achievable. And sometimes it's not achievable by yourself. We do a lot of things in life that requires instruction. I mean, kids are in school now because they're getting instruction. Nobody gives us instruction about how to break habits. Nobody gives us instruction on how to live a healthier life. K through 12, we may have a health course, we may have a science course, but sometimes those science courses are not about health. And that is the most important thing because as we mentioned before, if you don't have that, your quality of life will suffer. And we don't really teach that. So sometimes healthcare coaching provides that avenue to help people along the way to get from where you are to where you want to go. If you
Hmm.
don't know how to eat, if you don't know, how to fix your sleep routine, if you don't know, you have so many barriers that prevent you from exercising. Sometimes healthcare coaching can help with those things, pointing you in the right direction, helping you realize that there are barriers in the way, and for you to help you realize and recognize that so that those barriers can be removed. Because many
Hmm.
times people will say, well, I want to change the habits, but I have all these things in front of me that I can't do. Well, everybody's habits are different and everybody's barriers are different. And so sometimes you don't recognize what those barriers are. And so therefore you can't overcome that hurdle.
Hmm.
Sometimes I think it's better for if you can try to do it yourself and set realistic goals and have a growth mindset by trying to, always, be in the situation where if you have setbacks, that you can overcome those setbacks. Many times people have setbacks and they say, I'm trying to lose weight. Well, I tried. Well, it didn't work out. You know what I mean? You're gonna have setbacks. You're gonna have setbacks. But the question is, how do you deal with those?
Hmm.
You're not just gonna have setbacks with this, but you're gonna have setbacks in life.
Sure.
How are you gonna deal with those setbacks in life? Sometimes it's not that you go down, but it's how fast you get up that matters. You
Hmm.
can go down and stay down, or you can get back up and continue on, learn from that experience, and then move forward.
Makes a lot of sense. I like this idea of a healthcare coach. I think this is really helpful because we know the healthcare system in this country can be difficult to navigate if you don't have a coach, if you don't have an advocate that has experience working for a hospital. So, what are your tips in terms of working with the healthcare system in the United States today to be sure that you're actually getting the right advice and the right care?
Right. And that's a very difficult problem when people are not as knowledgeable as they could be about their health. So the
Hmm.
first thing I would say is become knowledgeable about yourself and be knowledgeable about your health care. And what I mean by that is, many times I will ask people, do you have a primary care physician? Some people will say, no, I don't have one. Well, why not?
Hmm.
And if they have one, they'll go see a primary care physician, and then I'll say, well, who did you see? Did you see a doctor, a nurse practitioner? Did you see a physician's assistant? Who did you see? I don't know. So you have to be involved in this process a little bit more than, who your organic teacher is, or
Sure.
your organic chemistry teacher is, you know who your physics teacher is, but you go to your somebody who is taking care of your overall health, and you don't know who that person is. We have to elevate ourselves in this system so that we are more knowledgeable about who is treating us. And so I think it's important for you to, whoever you're being treated by, that you have, that you're involved in, really good communication, that you have active listening on the behalf of the healthcare provider, that you are involved in the decision making. It's not this, paternalistic where the physician or whoever's treating you tells you what to do, but you have a foothold in some of this. You should be helping in making some of the decisions because it's your care.
Mhm.
It is your care. And so you have to be an active participant in that. And you have to make sure that if something happens where you're being treated with something and you're not getting the result that you want, you have to go back. Don't say, "Well, I went to the doctor, they didn't fix it, so I'm not gonna go back." No, that's part of the diagnostic process. The, if you come in, we may treat you with one thing, but if you come back, we may treat you with something else because that one thing didn't work. Don't
Mhm.
think, well, I went, I'm not going back. Don't think that way about it. So, you have to be involved in this entire process, the
Mhm.
entire process.
Hmm. You're an MD, so I think you're the perfect person to ask this question because it seems like every doctor is a specialist these days. Nobody is really holistically looking at all of the systems in the body and how they're all working together. So why aren't we looking at the body holistically anymore?
Well, I think it's the way that medicine has evolved over time.
Hmm.
We have become a nation of subspecialists, and there are some advantages in that, you get subspecialized care, that could be conceived as better care in many instances because there's too much medical knowledge out there for everybody to be an expert in everything.
Hmm.
And so that's the way that we have evolved. And so that's the advantage in it. The disadvantage is sometimes if you go to a surgeon for something or a subspecialist in something, that's all they see. You
Correct.
know what I mean? If it's like a, if it looks like a nail and I have a hammer, that's what it's going to be.
That's right. Right, right. I mean, if he's a surgeon, he cuts. Like that's what he
Exactly.
does, right?
So if you don't think I mean, so you have to just know that. It's like,
Yeah.
okay, do I really need this cut on? Or that's all he does. So, that's what he's going to recommend. So,
Right.
I mean, that's not always the case, but, it's that way. But, so the key is, we have never been a nation that you go to a physician and they take care of your spiritual needs, your emotional needs, your mental needs, your physical needs. That's never been medicine. But that's what we need, and sometimes it requires a crisis like COVID for the nation to realize that mental health is important.
Mhm.
I mean, I've realized, and people in medicine realize that mental health is important, but it's not until something like that happens that the press starts covering it. What's happening to our kids? I mean, these things have been going on for a while, but you all haven't been covering it, And so it's that way, even on a microscopic scale, that things have to happen before we recognize and want to take action.
Hmm.
You know
Yeah.
what I mean? So, I mean, that's just an illustration of that. Why does something have to happen before you take action? Because that's just how we function. I mean, I see patients all the time. I do biopsies on patients that have been smoking or been in a house with secondhand smoke, and they don't realize that they have I'm doing a biopsy, so they probably have a cancer that I'm biopsying, and they don't understand how they got the cancer. You spend all your life in a house amongst men or whatever, and they've smoked all their life, and now you have a cancer. Do you put those two together? I
Hmm.
mean, most people don't put cause and effect together, you know? And so it's challenging. And so we've become this nation, but you have to seek out kind of your own holistic approach. There are some physicians that do this, but if not, if somebody takes care of your body, if you need mental health treatment, go to someone who takes care of your mind.
Hmm.
You know,
Hmm.
if you
Hmm.
can't put it all together, you need a coach, have a coach that helps you put all that together for you so you can have a multidisciplinary team that can help you with whatever you're doing. You put it together. If it doesn't come together,
Hmm.
you can put your own team together.
Yeah, that makes a lot of sense. You bring up cancer, and it just seems like it's just pervasive. I mean, everybody knows somebody that is dealing with cancer now, and there are so many fraternity and sorority members that are listening right now. They raise tons of money to fight cancer. I think about Sigma Chi and the work that they do with the Huntsman Institute. Penn State, their fraternity and sorority members raise millions of dollars for the Penn State Health Children's Hospital. So the question of the day, and I'm sure, I mean, you would be a millionaire if you knew this thing, but how do we prevent cancer before it even starts?
Right, right. I think that's an excellent question. The way our system is set up so that, you know, once you develop symptoms, then you go to the doctor's office and then you get it diagnosed.
Hmm.
You know, when I do, biopsies on patients who come in for whatever tumor they have in their body,
Hmm.
I look under the microscope and it always amazes me that, cancer starts at the cell level. If it starts at the cell level, why do we wait until you develop symptoms? So it grows and grows and grows in this organ, and then it starts to cause symptoms, and may have gotten out of control, and then you get treatment.
Yeah.
Why don't we take the preventive steps? And those preventive steps could be, getting your mammograms, getting your colonography. If you smoke for a period of time, get your CT lung screening. If you're in the college student age, get your pap and pelvic to prevent cervical cancer every 3 years or so. So taking the preventive measures, these are measures are out there for a reason because they prevent disease. So don't be like some of the patients that I've seen before where I've not seen a doctor in 50 years.
Oh no.
That's not, I mean, you haven't seen a doctor I'm amazed. I'm like, 50 years, really? And and they have a tumor or something. There's something going on, obviously, because that's why they're seeing me. But it's just amazing. So you have to do the right things and take care of yourself. The key is if you don't take care of yourself,
Mm.
who is going to?
Nobody.
Is your mom, your sister, your brother, your kid, are they going to take care of you? If nobody takes care of you, who's going to take care of you? So you have to take care of yourself. It's your life. It's only your life.
Yeah, that's a really important message, I think, for our listeners to understand. It is your life, it is your responsibility. You can't count on your mom or your dad or your brother or your sister or anybody to really advocate for you. You need to be the best advocate for yourself and your own health and your own care and what you need. That is really, really critical. That's so important. Well, listen, I love this conversation. I think it's fantastic. I do love good food. I think that is my weakness, is eating really good food. And I know you like to eat healthy. That's cool. I like to eat healthy too. So in Indianapolis, the next time I'm in town, which I get there quite often for meetings, where should I be going for a great meal?
Yeah. I'm gonna start at a very unsophisticated level. It doesn't matter where you are. One of my favorite restaurants, I shouldn't say this, is Chipotle.
Me too, bro. I like it.
Now here's what I get. I get the
Oh,
salad. I don't get any
yep.
beans, any rice. I just get the salad and meat and avocado, or
Yeah,
guacamole. I don't get a whole lot of the other stuff on there. But if I'm in Indianapolis, I think my favorite places are, I don't eat a whole lot of steak, so I kind of treat myself when I get there. I like
right.
Fogo de Chão's, the Brazilian
Oh,
steakhouse,
very nice.
of course.
Very nice.
And the other place I like is Ruth Chris. They have a porterhouse steak for two that is delicious. That is delicious, you know? And so those are the two places that I mean, they're just excellent places.
Yeah. Well, listen, I love that you're keeping it real. You're like, you know what? Chipotle, if I can make my own dish, I'm down. I like it because I can do the same thing too. I think you can make good choices at Chipotle, even if you're a college student and that work for you, that, have the right ingredients and you can put that together yourself. So that's fantastic. And man, you like a good steak too. So I can appreciate
Right.
that.
Now, don't be like some of the people I've seen at Chipotle that get so much, they're asking for more and more and more. Can I have more steak? Can I have more?
Yeah.
That's like three meals there. That's like three serving sizes. Did you realize that? You're not gonna eat. I mean, sometimes even when I go, if I say double chicken or something like that,
Yeah.
that's like three meals, 2 or 3 meals for me.
Right.
I take half of it and I eat that. I can't eat the whole thing.
Right.
But I mean, they want more and more, and the guy is like, "No, this is what normally comes with a regular serving." And then the people get mad because you're not giving me enough. And I'm thinking to myself, "Really?"
I've seen those conversations, and the guy can't even close the burrito.
Exactly. You know what I
There's
mean?
so many portions. It's ripping the burrito. He's got to get three or four other burritos together to
Right.
keep it together. Oh my God.
Portion size. Portion
Portion
size.
size,
You know what I
guys.
mean?
All right. Well, listen, this has been a lot of fun. So, if our listeners, if they want health and well-being coaching from anywhere in the country, by the way, you don't have to live in Indianapolis. They have Zoom, they have all kinds of video conferencing options out there in terms of health and well-being coaching. So, where can they go to connect with you, Dr. Puryear?
Yeah, they can definitely go to my website, drjeromepuryear.com. That's drjeromepuryear.com. I'm on all social media platforms, Facebook, Twitter, Instagram, Threads, TikTok, YouTube. I'm everywhere.
I love it. All right. You're on all the social media platforms. You can find them on TikTok and Instagram. There you go. So, for all the young people out there, you can still connect with them. So, I love it. Dr. Puryear, thank you so much for sharing all this great information with us today.
Absolutely. Happy to
All
be.
right. To
Thank
our
you.
listeners, if you enjoyed this conversation, I want you to like it and I want you to share it on social media with other college students that need to hear Dr. Puryear's words. And we will see you on the next episode of the Fraternity Foodie Podcast. Thanks so much. We'll see you next time.